Hello everyone, so welcome to my channel. This is Shruti Ahuja, and in this video we are going to talk about femur, some important landmarks and some things which are asked in Viva, right? So first of all, I am having here the anterior view and this is the posterior view. In anterior view and in posterior, the common things are the head, neck and the body. So this is the head, the neck and the body. Next is, here you can see on the head there is a fovea for ligament of head, right? So fovea is a depression. You must have studied about fovea when you have studied in like the retina in your school, right? About retina there is a fovea, so there also fovea is a depression. Next is there is a neck. In neck there are retinacular foramina, and here I can see the greater trochanter and there is a lesser trochanter and there is an intertrochanteric line, okay, and there is also an intertrochanteric crest. See, in posterior view I am going to see the intertrochanteric crest because here I can clearly see this like hard surface, like which is appearing like a crest. What is a crest? If I am taking this pen and there is a sharp surface right here on it, then or if I take a scale, then I can feel that sharp surface of that scale. That is a crest. So here there is intertrochanteric crest, and here I can just draw a line. There is not such like protuberance or I can see not such eminence right there. So there is a line here and here it is a crest, and this is neck and this is a quadrate tubercle, right? Next is, this is lesser trochanter, greater trochanter, intertrochanteric crest, neck, and here I have told you there is a line, and I can see the greater trochanter and lesser trochanter from both the views, the anterior and posterior. If someone asks, then yes, we can see. Next, I am telling you that this was about the upper surface, right? Next, the body. Here in the body, in anterior surface, there is nothing for you to understand. But in posterior view, yes, we have many things like the pectineal line. If pectineal line is there, you must have heard about the muscle pectineus. So here is the insertion of the muscle pectineus, okay? Next is gluteal tuberosity. And here in tuberosity, gluteal tuberosity, you can guess there is insertion of the muscle gluteus, okay? It can be any, right? We will study that afterwards. Next is, this is linea aspera. This is linea aspera, the medial lip and the lateral lip. I hope it is very clearly visible. This is the medial lip and this is the lateral lip. This is the nutrient foramen. In every bone there is a nutrient foramen because we need some blood supply to the bone, right? This is the body, I have told you. Next, let's come to the lower surface of the bone. Here I am having the lateral epicondyle, the medial epicondyle, and here also I can see there is a medial, now lateral epicondyle. Epi means above, okay, something above. So there must be some condyle upon which we have built the epicondyle, okay? So the lateral epicondyle and this is the lateral condyle, and here it is the medial epicondyle and medial condyle. Here is the now adductor tubercle above the medial epicondyle, okay? So medial condyle, condyle, epicondyle and the tubercle. Condyle, epicondyle and the tubercle. So you can learn by the mnemonic TEC. So tubercle, epicondyle and condyle. Now you just need the mnemonics, but afterwards it would be very obvious for you. Now after the this tubercle, epicondyle, I have some line. See, this linea aspera was coming now. Now it will be divided into two. It will form a surface. You can see this surface. Let's name it. In future you will learn about popliteal fossa. So here is the popliteal surface. In posterior, this is the posterior view, okay? This is the medial supracondylar line and this line is lateral supracondylar, above the condyle, okay? It is superior to it, supracondylar. Next, this is the adductor tubercle. Now this can be marked in the OSPI. You just need to identify that these are the medial condyles Okay, now above it I am having the epicondyle, and above it I am having the adductor tubercle. So they can confuse you by writing like write some of the attachments of the marked structure. Now it could be adductor tubercle, it could be medial epicondyle, or it could be medial condyle. So you just need to first of all identify there are two tubercles right here, and you just need to see which tubercle it is and then write the attachments. Okay, because one mistake can cost you a question. Next is this is now if it is anterior surface, we know patella is on the interior side, so this will be patellar surface. And here I can, in the posterior view I have told this is the popliteal surface, but I haven't named this part. Now this is a kind of fossa. Here there is no fossa, but here I can see clearly that there is a kind of fossa. Okay, and this is called intercondylar fossa. Everything is related to some concept. Because there are two condyles, I have written intercondylar fossa. Now you can see they have drawn the line of attachment of fibrous capsule in green, right? In green here. So a viva question or an OSPE question can come, not exactly OSPE, but like a grand viva question can come. Draw the capsule attachment attachments, right? Where is the capsule attached on the lower surface of the femur? So in that you need to draw this attachment line. You can do this well from the BTC, because the main thing is about speaking in the viva. If you know the exact how the capsule attaches, then you can draw it very well, and this all you have to practice in your D halls. So, and here I can see line of reflection of synovial membrane. So I think so this was enough for just introduction of the femur and knowing about the basic features. I would also suggest you can use this book, because it gives you very well explanation of the structures. Obviously it can't match the real bones, but when you don't have those bones at home, you can just revise from it. Thank you very much, and if you like this video, then do watch the next one, which is on the anterior compartment of the thigh, which will be coming soon.